Paul, welcome to one of our homes at HC1, which is Douglas View in just outside Glasgow, which is one of our large multi-site homes and managed by the wonderful Louise Fulton. So welcome and thank you for coming today.
No, thank you very much for having me. First impression's amazing. Just integrating with the staff, seeing some of the residents, incredible place. So looking forward to continuing the tour.
Yeah, and I think we've seen some wonderful interactions already between the staff and the residents.
Yeah, and the collection of donuts, cakes, teas and coffees, yeah.
Brilliant.
Fantastic.
So Paul, we started this journey with Radar Healthcare about 18 months ago, I think, when we first met.
Did.
And myself, James Tugendhat, yourself. And we've been on a really good journey of partnership ever since then. And I think we've taken our time to get this right for us and to understand how the system can really help us to not only record incidents better, but to really understand everything about a resident that we need to therefore learn and improve continually. So I think it's been an incredible partnership, and Radar Healthcare have really helped us understand that. And even today, we're getting feedback about how we can continually improve that.
Yeah, no, I mean, yeah, you and I, as you say, 18 months ago when we engaged, I think the thing that came across was that shared vision and passion, that this wasn't just about we're putting a system in. So it wasn't buying a piece of software. It was, certainly from my perspective and our perspective, it was, this is a genuine partnership to drive change and improve the outcomes across those residents. So, yeah, I got super excited. And I know we've talked about some amazing things that we can do downstream, but in the here and now, some great functionality to be delivered and some amazing outcomes.
Absolutely. I think you're hitting the nail on the head about it's not just a system, because the easiest thing in the world would just go out and buy a system and that would do what we currently do, which is basically record incidents and file them. What we wanted is a system that can move us into the direction of giving us the insights as to exactly what's going on with a resident and to really understand them as a whole. And the partnership with the Radar Healthcare has got us to that place, I think.
Yeah, no, definitely. And I think what was interesting was in those early days when we had the conversations, front and centre were your homes, your people, the residents. Whereas sometimes when we engage with, people that are interested in Radar Healthcare, it is at a functional system perspective. Whereas we found with HC1, it was actually we're starting with the resident, starting with how we do things as an organisation. And that was front and centre in terms of, in fact, right to now is how we're going to deploy and roll this out.
Absolutely. And that aligns with our principles of being the kind care company, and our whole approach to kindness when we deliver care is about, at every resident level is understanding what is it we can learn to make their life better. So if somebody's falling and they're falling continually, why are they falling continually? Not just counting how many times they've fallen and where and what time, but why, and how can we stop them falling again to keep them safe and give them a better quality of life. And right through all the incidents and events that will be recorded in Radar Healthcare, that's absolutely key, is that level of understanding at the resident level. And then all of that reporting gets aggregated up to people like me, but actually it really matters about how it improves that resident's life each day.
Yeah, and I think that was it. I mean, you touched on it there in terms of the reporting and the insight. And again, we had these conversations very early on that... And you mentioned that things get aggregated up to, to yourself and others, but actually what you wanted to do was put it in the hands of the carers, the home managers, the insights that they, and the benefits that they can derive to apply directly to their homes so it impacts their residents. Absolutely. I mean, that came across really clear.
Yeah, and I think that's really important. So if you take the manager here at Douglas View and any of our homes, at the moment, they have access to sort of data, which is basically just numbers of things that happen. In order to really continue the wonderful work they do in the homes, we've got to give them the insight about what's going on. So that might be trends, but it might be about, for example, how people's, if somebody falls or somebody has a wound or whatever, why did that happen? And what could we do better next time? And we have a unique opportunity at HC1 as well, because we can do that at a local level and understand each resident. We can then move it across the whole organisation, given the numbers of homes we have and the number of residents we look after, to do learning on a massive scale. And so, we talked right at the beginning that actually this isn't just a safety system for us and a recording system, it's a learning system, and that's fundamental to us.
Yeah, absolutely. I know we're here in Douglas View, and I already met with Louise, and her passion comes across. But, one of the things that she flagged up was there's absolute commitment within this home and every home within HC1 to deliver amazing care. And then some of the elements mean that they get quite stretched. And so one of the benefits and outcomes that we discussed was to ensure that we bring those efficiencies. Yeah. So there's a lot of automation, but the key point being is, how do they make sure that they continue to live that amazing care and improve that care? So that is it can't just be an instant reporting. It has to be a learning management system and a supportive system that's going to help make informed decisions and affect change. And Louise already looking to drive that, which is incredible.
Yeah, absolutely. How powerful would it be that the learnings that Louise identifies in this home are also understood by our homes in London or in Wales or any part of the country? We've got an amazing opportunity to share that learning.
Yeah, I mean, that's directly aligned to us as well. So one key function within Radar Healthcare is our Radar Healthcare community. And so it's not just that people within HC1 are connected. All of our customer base, all of our partners are connected, and so that you get that shared learning. But yeah, I mean, exactly what you say. You get some great insights, and I know something we discussed as well, which was reporting excellence.
Yeah.
So a real driver to quality it shouldn't always just be the adverse, events. It is where we see excellence, and you see excellence within HC1. How do you capture that? How do you define it? And then how do you share that? So this project and the rollout of Radar Healthcare with HC1 will give us that opportunity to really share best practice, implement it, and learn from that and drive change.
Yeah. And I think that's a really important point about the excellence, because all of our homes do incredible work every day. And I was saying to somebody earlier, I think on average we deliver about 7 million care interactions a year. Yet our incidents are around about 65,000 a year. So think about that 6.5 million of care interactions that are really positive every single year that we need to celebrate and learn from. And I've seen today, as we've both seen, some wonderful things happening in this home. And I want to make sure that we all understand that across all of our homes, because that will definitely drive improvement forwards.
Yeah. I think, again, just speaking to the local team here and some of the engagements we had prior to this, there is a thirst for having a system, because it's these guys within your organization that want to drive, the best outcomes. They're so passionate about it. Came in, as soon as we walked through the door, it was immediately, I want this, I want that. How can it help me do this? So, I feel this partnership will help satisfy that thirst for giving them the systems and tools to drive that change.
Well, absolutely, because every colleague I meet in this organisation and other care providers, they work in care because they are passionate about delivering better outcomes for people. Yeah. And it's really important that as a company, we give them the tools to enable that. Because, as you say, that's what they want to do. They don't, Louise and her team don't come here every day just to do the same job. They constantly want to give people the best possible life. So we need to give them the tools to enable that in a simple way, but in an insightful way.
Yeah, I mean, this is you're practically defining our mission statement. Yes. And so we were saying there, what do you do? And sometimes you can say, we have a learning management system, an incident reporting system, but fundamentally, we have a system to help organisations like yourself deliver better healthcare outcomes. And I think that, as the anchor point of this partnership, is what's helping us drive these decisions and the direction of travel that we want to go.
And fundamentally, if you focus on resident outcomes and improve people's quality of life, all the things such as regulatory outcomes and things will flow from that. Okay, that's got to be the key driver about building the information and the improvement around each individual resident.
Yeah, invariably, if you look at from a regulatory perspective, where you get homes that are rated at the highest level, it always comes back to the resident and the outcome that they achieved. So you're right. If you work back from that, invariably you'll have quality outcomes and metrics that have been applied across the organisation. So.
Yeah, absolutely. So as you know, the rollout of Radar Healthcare is part of our wider digital care program, and it's like a giant jigsaw really, we've had our EMAR system, our eMeds, we call it in HC1, for around 2 years now. And that was rolled out during COVID, so it was a really difficult period to roll that out. But all of our homes now are using that and have adopted that. We're now bringing the rollout of Radar Healthcare through October, November into our homes. And then the third part of that jigsaw is to roll out the electronic care planning solution, which is with another organisation called Nourish. But what we've all been working on behind the scenes, and particularly through our partnership with Radar Healthcare, is how these three systems can integrate so that our carers can have a device in their hand that not only can they work with the care plan, but they can see the medicine's history, they can work with the medicine system, but actually when they walk into somebody's room and seeing they've had a fall, for example, can record that incident through the care plan for it to go seamlessly through to Radar, and Radar does all its magic behind the scenes and then writes it back to the care plan. And that's what we're achieving, and that's what our aspiration over the next year is to make that work. And that's through the partnership approach with yourselves and other partners such as Nourish.
Yeah, and interoperability, it gets bandied around quite a lot, but I mean, again, right in our early conversations, that was the heart of everything. Yeah. And if you think about it, there's so much power and value and knowledge and data that's captured within these systems, within the meds management system, within the care planning system, within Radar Healthcare. Why wouldn't you want those systems to talk to each other in an intelligent way? Because then there's two things that occur. There's the efficiencies that you just mentioned, that if I'm a carer or a home manager, that I've got access to all those systems from any point and any device. And we want that data to flow through, and as you alluded to, informing other systems to what's happening. But then the fact that you've got the data flow, and then I can at a holistic level to see what are those interactions, what do they mean? And that for me is where interoperability really comes into play, because now we're getting insights holistically, and we can collate all that data, and we do that in Radar Healthcare, and we can drive meaningful interactions and outputs from Radar Healthcare based on multiple systems.
Absolutely. I mean, just think about, we've talked about falls a number of times, but you just think about somebody who's fallen, and your carer goes into that room and will record the fall on the handheld device, and it'll go through to Radar. But actually, if we've got those data flows right, that carer will be able to see, well, actually, that person hasn't had the medication today, or they've missed the medication, they've refused the medication, or they haven't had enough to eat today, they haven't had enough to drink today, they may have an infection. All of these kind of things provide that whole picture around that resident, so we can actually then understand why he fell. And that's the power of what we're trying to do with that data flow.
And again, once you've got all that information, you've got that learning. We talk about learning management system. What does that mean? So I know the drive of HC1 is prevention.
Yes.
It's intervention, so that when we look at that resident, that those triggers and interventions are notified so that we prevent those occurrences. And I think that for me will be a great key indicator for quality, is how we drive down adverse events and incidents. Because if you think about it, if we can prevent just, X amount of falls, if you translate that down to the impact to a resident, that's a person that's had a fall and, sustained potential injury that can affect, the quality of their life from that point forward. So it's our duty of care as this partnership to drive those down. So I'm excited about that.
Absolutely. So one of the key things that we've done in our partnership and preparing for our rollout is to look at the audits. And as an organisation, as you might expect, we have a number of audits that we either are obliged to do by our regulators or need to do to improve care. But auditing for us has been largely paper-based with a few internal developed apps. Now, the problem with that is that certainly our paper-based auditing doesn't give us the oversight of what those audits are actually telling us. So whilst it serves a function at a home level, across the company and to identify what we need to do to support homes, we don't get that oversight. So we were thrilled and we delayed our work on the auditing, so Radar Healthcare released its new audit module, which has given us an incredible flexibility to build our audits, refresh our audits, bring them in line with national guidance, making them really meaningful to people, And now all of our audits will be in one place. The managers will be able to do these very, very easily through a really simple platform on Radar Healthcare, and we'll get the power of those audits. So as an organization, we'll be able to understand what it is we need to do to support our homes.
Yeah, no, the kind of audit functionality is, and what was really refreshing is, and maybe you can, touch on it a little bit, was where you, instead of it just being a checklist, there's complexity within audit that you've got to underpin from a functionality perspective, and we do that. But the interesting thing from a HC1 and this partnership was that when people are running audits, and I'm going back to the thirst for, is they see it very much as, how am I going to use this function, the auditing function, to help identify to me where I need to improve, and that I can also link in the actions, I can feed it into the analytics. Did I affect the change that I wanted to? So the next time I run it, it's going to give me that outcome, or that kind of indicator that I'm achieving those outcomes. So it was very much moving from a yes, no, am I meeting this requirement, to yes, no, but do I feel it's meeting the requirement from me and my home? So I know, in terms of how you talk about assurance rather than yes, no. So
what we've done in working with the audit module is to completely change the language. And as you quite rightly say, auditing traditionally has been yes, no, and is a tick box exercise, to a certain extent. And some of that's been driven by the need to achieve regulatory compliance, etc. But actually, if you use auditing in its true sense, it should identify where you need to improve, that then links to the Radar integrated action plan. So we needed to change the language. So now our audits are asking managers to say whether they're assured or not. So I am assured that my linen cupboard is stocked fully. And if you're not assured, it doesn't matter. It doesn't matter at all. What matters is the action that follows. And so what we're asking managers to do is say not just yes, no, but I'm assured or I'm not assured. And if you don't feel assured, let's work together to find out what the improvement needs to be. And I think that's going to be quite a powerful message that we're going to work through.
Yeah, I think culturally as well, just that shift from I kind of want to get lots of greens. Well, actually, a shift to moving to this, and that's certainly something that we've thought about when we're working with the likes of yourselves when we've been developing the enhanced audits, it is how does it give you a true indication? And I think that culturally, where I'm almost encouraged, and it's held up, as an exemplar to say, I've identified these areas where I'm not fully assured. So therefore I'm going to put more in. Whereas historically I could have just said, well, yes, theoretically, so I get a green.
Yeah.
So no more C's of green.
No.
Well, actually I'm getting C's of, here are genuine areas that I need to, embed a further assurance before I feel that I'm fully compliant or where I want to be.
Absolutely. So it goes back to that language. It's taking away the drive for 100% or pass-fail, which is some of our traditional audit kind of language. And then we count how many 100% we've got or how many passes we've got. And then we almost sort of view a fail or something less than 100% as a negative. But actually, we need to do it the other way around. And actually, we need the audits to identify the improvement. It's inconceivable that there's not a single home in our portfolio that cannot identify improvement through its auditing process. So what really matters is that we do have audits that are in the old language failing or are less than 100%. Because all we want the manager to say is, I'm just not assured. So I need to then go and identify the improvement. And I think then we'll get a much better view of the improvements we need to make. And the benefit of Radar Healthcare for us is that then seamlessly goes through to the integrated action plan, where the manager then has a really clear focus on what he or she needs to do to make that improvement. So when they rerun that audit, it's in a better position, and then they know they've made that improvement.
Yeah, and again, having a conversation here at Douglas View was around what are the precursors to an audit? You've got your scheduled routine audits, but then how do we know when should we audit? So we were having the conversation. So Radar Healthcare's analytics helps you identify where you might have trends or deviation. And then even within the action plans that you mentioned that are integrated being able to identify and linking where I can see a specific action that it almost self-prioritizes the action, because that action might be related to multiple incident events. It might be linked to multiple audits that's identifying. So helping home managers prioritize.
Yes.
Because, time is one of the most precious commodity in healthcare. So being able to help focus and prioritize some of that, and then measure the effectiveness of that action.
Yeah.
So
and what you described there is, really important, because each one of our homes is very, very different. There are no two care homes the same.
Yep.
And they will have different things going on and different sets of circumstances all the time. So the ability to give people the information so that they can, apart from the scheduled audits, use auditing effectively to drive improvement, and then understand the priority of that through the action plan is incredible.
Yeah, and then the flexibility of the audits already. I was hearing conversations as part of this partnership as to what, if you think about it and I know this firsthand from a regulatory perspective, where you see organisations that get rated as, outstanding and the best of the best, is that there's a step of going beyond what's prescripted within an audit. So already it is, and one of the insights and that's first again from a HC1 perspective is, how do we enhance those audits to further drive improvement? What additional checks can we incorporate that are a true measure of quality? Again, using the resident as the anchor of that.
Absolutely. It always comes back to the resident. What is it that gives the resident the best quality of life? And it's not the driver is to satisfy a regulator. That will follow if you do that properly. And as you say, to build audits in such a way with the flexibility in our partnership and the system, we've been able to build the audits that drive to that outstanding level of quality of care.
So obviously we've come on this journey. We've talked about some of the amazing things that we hope to achieve and some of the great outcomes we're going to deliver. And now we're getting into the actual deployment and the rollout of this. I was wondering if you can just talk about, the approach, and certainly I can share in terms of the partnership as to how that's going to look and feel for the organisation itself. But hearing from your perspective as to how are we going to roll this out and how's that going to look and feel?
Sure. So we've taken our time to really understand the challenges, obstacles, and the benefits that homes are going to face in order to plan that rollout. So we've been doing something called real world testing, and we've been doing that since July in 4 sites, one here, Douglas View in Scotland, 2 in England, Shortland Place and Clarendon Hall, and 1 in Wales, Aberpennar. And we've been running that testing, working really closely with the managers. The team have been listening to the managers, taking their feedback, changing parts of the system to make sure it's operationally viable and gives them the outcomes they need. And colleagues from Radar Healthcare have come to each of the 4 sites with us to listen and understand and get that feedback and literally make amendments to the system as we've been talking to the managers. So it's all been fed from the managers about what's important to them and the area directors. And certainly in Wales, we also have a regional director giving us some really interesting feedback. As we move forward, we start our rollout to all of our homes in October. And we've got a really active rollout plan that will last 8 weeks across 280 something homes. We're going to support homes by giving them an individual training session that's individual to them on each of their day of rollout. And we've got a support function behind the scenes about how we're going to support them, how they can reach out for help, etc. But the feedback we've had from all of our testing sites is that this is really easy, and they've taken to it really well. And it's all quite instinctive. So that's our rollout plan. And so by the end of November, all of our sites will be active with Radar. And we're also currently working on building all the analytical dashboards that people will find useful and valuable for all the reasons we've talked about.
Fantastic. I mean, personally super excited. And I suppose it must give assurance to those that are going to be receiving the system that this has been done in a way with, this isn't done in isolation of the organisation. This is absolutely, within each of these care homes that you mentioned, and the people that represent everybody else in the organisation that's going to use this on a daily basis. So I think getting assurance that as we find the ways and the nuances that invariable that come out home by home, we can still accommodate those, but the foundation of the system and the configuration and the methodologies they roll out is based on HC1 and the people that work within HC1.
Yeah, absolutely. And working on the very foundation that this has got to work for the home manager. This has got to give the home manager and their teams the information they need to make those improvements we talked about. So if we don't get that, we would have failed. So it's really important we've taken our time working in partnership with yourselves to get to that point. And ultimately, if we can't improve a resident outcome, there was no point doing any of this. So again, what we've been doing during the real world testing phase is to make sure that what we're learning is going to improve a resident outcome. So the feedback we've had from the managers and their teams has been absolutely valuable in doing that. So I'm really confident and assured that we're going to have a system that's been really built around the individual resident with that feedback from the people who actually deliver the care.
I mean, if I was going to give any assurance, to the staff of HC1, I would say this as well. Not only is that hard work and hard yards been put in before Radar Healthcare is rolled out, but rest assured that as part of our partnership and one of the demands HC1 put on Radar Healthcare was this has to be able to be iterative.
Yes.
So we can't have a fixed system because the world evolves. You have nuances through different regulators in different regions, and they have to be accommodated. So my kind of assurance to those workers, if it doesn't work or it's not working in the best way for you within your organisation, then there is the capability and capacity to make those changes within a controlled way, of course. But
yeah. And that comes back to the partnership approach, doesn't it? Because it's about, this isn't just a one-off. Here's a system. Thank you very much. Off you go. This is a constant evolution, and as we bring in Nourish to sit alongside Radar and integrate with it, that again will involve more evolution.
Yeah.
And as you say, the nature of our residents will change in the future. The demands of our regulator will change. They are changing currently. The demands of our commissioners will change. But fundamentally, we just need to have a partnership where we can keep evolving and meeting those expectations, but still allow us to deliver those outcomes for people.
I think another kind of less tangible benefit as well is we alluded to it earlier in the conversation about the community.
Yeah.
And, it's not just HC1, it's lots of organisations. But if you bring it back to HC1, again, for that the assurance of, the carers, the managers, it instantly creates a community where you can communicate across all homes or where people have found best practice, a way of doing something that can be shared, quickly deployed, measured. If it's effective, then it's rolled out. So whilst at individual locations, we're driving improvement and change, improving resident outcomes, holistically, the whole organisation, and I know that's a commitment on both our sides to drive that holistic change.
And if you just think about where we are today in Scotland, the regulatory framework in Scotland is very, very different to England and is different again to Wales. And the regulations are different. The way they assess the quality of care is very, very different. And there's huge opportunities to learn. So, for example, in Scotland, the whole regulatory framework is very much around the rights of people and their rights to autonomy and independence. And whereas the English framework isn't quite like that at the moment, but there's great opportunities to learn from what goes on in Scotland and how they manage incidents and how they drive that improvement to meet the expectations of the regulator. If we share that learning into England, that will also drive the care up.
Yeah, and I think that's something our commitment as a technology partner to and Radar Healthcare is, because we have such a broad mix of partners and internationally as well. Yeah. And like we talked about excellence. Excellence was driven actually from within the Emirates.
Yes.
So we've seen within the UAE where they were successful in driving that because they saw the impact it had on the resident stroke patients. So it'll be things like that we collaborate on. And I'm absolutely certain of this, that we'll be sharing things that HC1 have done and pushing that out to the community. So collectively, we all learn, the net outcome being we improve, patient and resident outcomes.
Absolutely.